Hello, everybody. My name is Lindsay Massaro, and I currently work as a medical surgical nurse at Gaylord Hospital. And today I'm here to talk to you about kidney failure in adults age 18 to 65. The kidneys are two bean-shaped organs that lie on each side of the human body. It is plausible to live with one kidney, but the role and function of the kidneys are vital to survival. The functions of the kidneys are to eliminate wastes from the body, help regulate blood pressure, help maintain a constant blood pH, help aid in drug excretion, produce red blood cells, synthesize vitamin D, hormone synthesis, and help maintain a proper fluid balance. Although it's not common in patients 18 to 65 to suffer from kidney disease, there is an incidence of chronic kidney disease among people 20 to 64 years old, and it is statistically known that it's less than 0.5%. Kidney failure is a chronic or acute manifestation that disables the kidneys from functioning in an opportune way. There are two types of kidney failure, acute or chronic. Acute can happen suddenly, and chronic kidney failure happens over time. Either way, the risk factors for kidney failure remain the same. Modifiable risk factors are those that can be changed. The patient has control over these factors. Non-modifiable risk factors are things that the patient does not have control over, things that they were born with or genetic predisposition. Modifiable risk factors would be smoking. Obviously, the cessation of smoking would help. Maintaining a diet low in protein and potassium. A regulation of fluid intake to prevent the body from dehydration. Lifestyle changes. Obesity, maintaining a healthy weight. Routine exercise, preventing yourself from getting diabetes or hypertension. Non-modifiable risk factors would be things like race, such as African American, who are most at risk, gender, which are males at most at risk, a family history, age, which happens to be over the age of 50, you are more prone to kidney disease, and involuntary accidents such as burns, traumatic injuries, or things that you don't really have control over, such as septic shock. Next, I'm going to talk to you guys about the changes that are affected in the body by a patient that suffers from chronic kidney disease. Hemopoietic and cardiovascular changes are the first. There's a decrease in the production of erythropoietin, therefore there's a decrease in the production of red blood cells, leading to anemia. Erythropoietin is what is used to make red blood cells, and a patient that doesn't have enough red blood cells has anemia, which a patient will feel fatigued or weakness. They will start to feel cold all the time. Their hands will feel cold. Their lips may turn blue. A patient that is suffering from decreased oxygenation will have hypoxia. Their O2 stat will drop below 90%, and this is evident at rest and at exertion. There will be a low blood pressure as a result of the kidneys' inability to keep the blood circulating. Possible renal ischemia related to low blood pressure and inability to keep the tubules saturated with blood. A mean arterial pressure less than 65, leading to underperfusion, resulting in cellular death. The cells will become necrotic because of their lack of blood. Hypokalemia, which is a decrease in potassium. Potassium is responsible for muscle contractions. And when there's a decrease in muscle contractions, the heart has an inability to pump. The heart is a muscle, and the contractions will just stop. A patient can also go into congestive heart failure as a result of the hypokalemia and as a result of the fluid overload. A patient with congestive heart failure will hear crackles in their lung. They will feel edema. There will be jugular distension. They may feel like they're having a hard time to breathe. If not corrected right away, the patient can suffer from death. The integumentary system is also affected. A patient will suffer from edema. There can be +1, +2, +3, +4, depending on the amount of fluid that's located within the cellular walls. When a patient is unable to excrete the fluid because the kidneys aren't working, the fluid backs up and builds. When the fluid has nowhere else to go, this fluid will start leaking out of the skin, which creates weeping edema. Uremic frost is also almost like a frostbite. The kidneys are unable to excrete uric acid, so the uric acid will come through the skin and create a crystallized texture. A patient will also suffer from stretch marks as a result of the edema. The skin will stretch and will be unable to go back if there's full fluid. As well, a patient is most at risk for skin tears or bruising. The skin becomes very fragile due to its nature of being stretched so much. Respiratory changes will also occur as a result of kidney disease. Changes in the respiratory system usually happen as a way to dilute the systemic effects of the renal acid-base balance disturbances. These disturbances are evident when the pH is off, when the pH becomes more acidic or more basic. A patient will suffer from complications such as pulmonary edema, pleuritis, pulmonary calcification, a predisposition to tuberculosis, which is a lung disease, sleep apnea, pulmonary hypertension. A patient may suffer from signs and symptoms if they're having complications in the respiratory system, such as shortness of breath, hypoxia, which is an O2 stat that drops, a fatigue, dizziness, chest pressure, swelling in the ankles, legs, and eventually the abdomen, or a bluish color to their lips and skin. The patient requires oxygen right away, may even require to be ventilated to assure that the lungs are working properly as a result of the kidney disease. The kidneys are responsible for the acid-base balance. If the kidneys aren't working properly, the acid-base balance will be affected. So this homeostasis is interrupted, as well as the fluid and electrolyte balance, and the effects also happen within the urinary system. There can be fluid overload. The body may not be able to excrete enough fluid, and then there might be dehydration where the body excretes too much fluid and the person isn't drinking enough, and this can cause injury to the kidneys as well because they don't have enough of water to help them filtrate. There can be fluid and electrolyte imbalances. Like I said, patient can suffer from dehydration, which is a fluid imbalance, or fluid overload, which is a fluid imbalance, and or electrolyte imbalances, such as the electrolytes are potassium, calcium, sodium. Each play a vital role in maintaining homeostasis. There is a decreased glomerular filtration rate, meaning that the kidneys don't filter as fast as they should. This can be evident in lab work. A patient that has end-stage renal disease, for example, has a glomerular filtration rate of less than 30. Drug toxicity happens when the kidneys are unable to excrete the amount of drug that the body has taken in. Drug toxicity can lead a patient to losing loss of consciousness or suffering from adverse effects of the medication because of the buildup. For example, vancomycin is an antibiotic that is excreted through the kidneys, and when this buildup of vancomycin happens in the body, it can cause more damage than good. It is important to monitor levels of such drugs to ensure that they are being excreted properly through the kidneys. There's a peak rate that they should maintain. Infection as a result of waste accumulation. If this glomerular filtration rate is low, waste will accumulate within the body that can make a person go septic. A patient go into septic shock as a result because the waste aren't getting excreted, and it can go into the bloodstream and make a person very sick. The gastrointestinal changes that occur are that there's an increase of these toxins, there's an increase in waste products, and an increase in water. A patient may feel that they're gaining weight for no reason at all, and that can be due to the fluid overload. A patient has decreased motility of the gut. They can suffer from indigestion, acid reflux. They can suffer from nausea, vomiting, a poor appetite, a poor taste in their mouth, just not wanting to eat very much at all. So that therefore they can suffer from poor nutritional intake, and this can be evident in their electrolytes. A person that doesn't take in enough sodium, for example, will suffer from hyponatremia. Or a patient that doesn't have enough calcium in their diet will suffer from hypokalemia. A patient that suffers from, low potassium will suffer from hypokalemia. This will cause muscle cramps. So all these dietary things need to be taken into effect for a patient's gut to heal as a result of kidney disease. A patient will suffer from musculoskeletal changes as well. They have an increase for osteoporosis. There will be a decreased synthesis of the vitamin D, which a patient can be put on supplements of vitamin D as well as get more sunlight. There's also low levels of calcium. Calcium is needed to form healthy bones, and when the kidneys aren't able to function properly, this decrease of calcium can cause rickets or can cause bone spurs if not corrected. Reproductive and endocrine system are also affected. There's disturbances in the menstruation due to blood pressure and not enough platelets, because again, the kidneys are responsible for the red blood cells. There's an increase in uremic toxins. That's where the uremic frost comes in. There's decreased FH and LH hormones, which are responsible for menstruation and ovulation. A patient with kidney disease may suffer from issues trying to get pregnant related to these hormones. There's a decrease in libido. Men may suffer from erectile dysfunction and abnormal sperm production as well. Sensory and nervous systems are affected because a patient usually with kidney disease might suffer from diabetes, and a patient may not have the sensation in their extremities that they should, and there's alteration in pain reception. They suffer from neuropathy, and the pain comes from nowhere. It may be phantom pain as a result of the diabetes, and sensation just doesn't feel the same as it should. And nerves may set off signals that shouldn't. A patient may suffer from tingling or pins and needles for no reason at all. Next, I'm going to talk to you guys about prevention of kidney disease, primary prevention, secondary prevention, and tertiary prevention. So primary prevention is staying away from the disease at all. So obviously the best form of treatment is prevention. Prevention of the modifiable risk factors, the things that we have control over. So we can prevent hypertension by maintaining a healthy blood pressure, systolically staying less than 140, knowing the parameters of a healthy blood pressure, knowing the signs and symptoms of a high blood pressure, knowing the things that can cause high blood pressure, such as stress. Prevention of diabetes, checking blood glucose, again, knowing the parameters of a proper blood glucose, knowing how to stick to a healthy diet, carb counting, seeing a dietitian, decreasing processed foods, eating more fruits and vegetables, maintaining a diet that is moderate in protein because we know protein can cause kidney disease, routine exercise, getting out there for 30 minutes a day, 5 days a week, brisk walks, non-smoking. There's many things that can a person can do to stop smoking, such as nicotine patches, nicotine gum. There's many campaigns out there. There's so many YouTube videos. There's commercials on TV all the time. I've heard of Wellbutrin. Patients can also go and find out why they're smoking, maybe a psychological consult to help them cope with smoking and cope with what they can do in place of. And pay attention to over-the-counter medications. Nowadays, most people prefer to medicate themselves instead of going to the doctor. Issues with insurance or compliance. NSAIDs can be very toxic to the kidneys if not taken in moderation. They will cause more harm than good. A secondary prevention is a patient that is at risk for the disease, such as genetic predisposition, or because of their gender, or because of their race. These patients need to participate in routine checkups, as do those who aren't at risk, but these patients especially. These patients need to see nephrologists. They need to see their primary physicians. They need to have routine blood work to monitor their BUN, their blood urea nitrogen, their creatinine, to monitor their glomerular filtration rate, to monitor their electrolytes. These patients need to increase fluids greater than 1,000 mLs a day. These patients need to be aware that water is probably the most important fluid. It is the most important fluid. And things such as coffee and tea, these caffeine things that keep us running, can actually dehydrate you. And a patient needs to adhere to their medication. If a patient does suffer from diabetes or does suffer from hypertension, these patients need to take their blood pressure meds or take their insulin on a routine basis, knowing that these medications can save their life. Tertiary prevention and the treatment plan of a patient that suffers from kidney disease. First of all, the most important thing to do is treat the cause. A patient can enter the hospital for an acute attack, or the patient can be under a chronic attack. These causes can be from septic shock, infection, involuntary accidents, dehydration, high blood pressure, increased blood glucose, contrast dye. A patient gets a CAT scan and the toxins aren't eliminated through the kidneys and there's a buildup of this contrast dye. A patient can suffer from allergic reaction to the contrast dye. Nephrotoxic drugs, such as the vancomycin, like we had said before, burns, or kidney stones. Either way, it's important to treat the cause of the disease or the injury. Medication management. So, proper glucose monitoring, finger sticks, before meals, twice a day, whatever is prescribed. Using the insulin or the oral agents such as metformin, antidiuretic hormones, Lasix, spironolactone, things to decrease the fluid overload in the body that may be related to the kidneys, to decrease the chance for congestive heart failure. ACE inhibitors, ARBs, these things are going to help decrease the blood pressure so that the kidneys can filter properly. In intravenous fluids, if the patient is severely dehydrated, the patient will be started on intravenous fluids to increase the amount of fluids, to increase their electrolytes, to increase their overall fluids so that the kidneys don't remain in this dehydrated balance state. Laboratory tests are another important part of treatment plan. Like I had said, the BUN, the creatinine, the GFR, which is the gold standard to know if the kidneys are filtrating at the rate that they are supposed to, and electrolytes. The technological equipment that is used for a patient in kidney failure is CAT scans, MRIs to view the kidneys, to see if there's issues. Telemetry monitoring, if a patient is suffering from hypokalemia, like I had said before, this will monitor the heart rate to make sure that the heart is contracting properly. Ventilation, if a patient isn't breathing on their own due to respiratory failure from kidney failure, and dialysis equipment. Surgical interventions would be nephrostomy tubes to help drain the urine directly out of the kidneys. Insertion of a Foley catheter to monitor strict input and output. A fistula for dialysis, a graft for dialysis, a central venous catheter for dialysis, or a patient can go through a kidney transplant. It's always important to educate, whether you're a nurse, a doctor, family member. The patient needs to be educated correctly and about the importance of monitoring and keeping their disease at bay. Teach a patient importance of medication adherence. Teach the patient for signs and symptoms of infection. These sites can get infected very easily where the patient is receiving peritoneal dialysis or hemodialysis. Sterile technique is mostly used. Teach the patient dietary restrictions. Like I said, a diet low in potassium, a diet low in protein. Teach the patient's importance of blood work and follow-up appointments. Nursing interventions and outcomes. A patient will have equal or negative intake and output during their hospitalization. So the patient will take in what they put out, basically. They won't be putting out more than they take in, because this will cause dehydration. Monitor output of the urine for color, smell, and clarity. There can be fibrins also located within the dialysate that's used for dialysis. That needs to be monitored. Encourage fluids. The patient will remain free from or have decreased edema because, again, edema is a sign of fluid overload. The nurse will assess the patient for any abnormalities, including signs and symptoms of infection. And the patient will know how to take his or her blood pressure and blood glucose levels. And rehabilitation is the last thing for treatment. If a patient does have a kidney transplant, they need to adhere to anti-rejection medications. They need to participate in physical, occupational, and speech therapy to get back on their feet after surgery or after suffering from an acute attack. Wound management, to care for those wounds where the fistula was placed, or a diabetic wound that the patient might have suffered from, to know to check places that could potentially harvest wounds, such as the feet, where the patient doesn't look very often. And if they have this decrease in sensation, then they might not feel that they're getting a blister that might open and form infection. A daily exercise regimen, dietary restrictions, smoking cessation. All these things in the treatment plan are important for a patient to decrease their chances of getting chronic kidney disease. It is very unlikely that a patient 18 to 64 will suffer from kidney disease. Actually, 0.5% do suffer from kidney disease. Again, the risk over the age of 50. But as a healthcare professional, it is important to adhere to a regimen that a patient is comfortable with and that will bring positive outcomes. Just wanted to end the PowerPoint with a little bit of a concept map over here. To the left is, again, the modifiable risk factors. At the top is 2 things that can be done to assure that a patient doesn't get kidney disease. And to the right is non-modifiable risk factors. And again, at the top is things that the patient cannot control. The bottom box is just a couple facts to tie up kidney disease and the process of disease and things that can be done to prevent. Again, the number one method of treatment is prevention. Thank you for listening to me. I hope you guys learned a little bit of something about kidney disease. And that sums it up.